Hello, everyone. Look at how disgusting this is. So, there's a report that came out about a hospital in Florida. This is from NBC, and it states roaches in the operating room. Doctors at HCA Hospital in Florida say patient care has suffered from cost cutting. I mean, seriously, how much money do you have to cut from the hospital budget for there to now be roaches running around in the damn operating room? That is supposed to be the most sterile place ever because you have people open and vulnerable, and there's supposed to be like sterile conditions in there. So that is a sad, dangerous situation. So on December 7th, 2021, more than a dozen surgeons convened a meeting at their hospital, HCA Florida Bayonet Point in Hudson, Florida. Their concerns about patient safety at the 290-bed acute care facility owned by HCA Healthcare Incorporated had been intensifying for months, and the doctors had requested the meeting to push management to address their complaints. Unsanitary surgical instruments, inadequate monitoring of ICU patients, an overflowing emergency department, anesthesiology errors that resulted in patients waking up while in surgery, all were allegations ripe for discussion. You guys, this part brings me to a memory that I have. I was maybe 24 years old, and I was having a nephrectomy, which means they were taking out my kidney, my native kidney that I was born with. And I woke up on the operating table, and I could feel my flesh burning, and I thought I was screaming, but I couldn't scream. I felt like I was in a dark box. I was trying to move my body, and I couldn't. I could hear music in the background. I could hear the doctor talking, the surgeon. And the only reason why they knew that I had woken up, because remember, my body was paralyzed, but the only reason why they knew I had woken up is because my heart rate and my blood pressure shot up. So they knew that I was awake. And when I came out of surgery and I was being wheeled back to my room from recovery, I point blank asked, did I wake up during surgery? And they told me the truth. They said yes. So, I mean, inadequate anesthesia is a thing, and it is scary. It is one of the most scary times I've ever had as a patient, waking up on an operating table. Anyway, back to the article. The meeting soon took an extraordinary turn. 4 doctors who attended told NBC News. With a hospital administration official on hand to hear the answers, the group was asked 2 questions. Is the hospital providing a safe environment in which to perform surgery? No, everyone in the group answered, according to the 4 doctors. Is it a dangerous place to practice? Yes, came the unanimous reply. The hospital administrator promised to address the doctor's issues, attendees told NBC News. But more than a year later, little has changed, they said. A spokeswoman for the hospital declined to comment on the meeting. HCA Healthcare Inc., owner of Bayonet Point, is America's largest hospital company, operating 182 hospitals and 125 surgery centers across the nation and in the UK. HCA is highly profitable. Last year, it earned $5.6 billion, and its stock is an investor favorite. But HCA's laser focus on profits can put its patients at risk as it cuts costs and corners, say 7 of the company's doctors in California, Florida, Texas, and Virginia, some of whom reached out to NBC News after our report last month about HCA. Nurses in 5 states concur. Most of HCA Florida's that have been rated by the federal agency responsible for Medicare and Medicaid currently rank below average. And state regulators have raised issues about patient care at Bayonet Point at least twice in the past 2 years. 4 physicians at Bayonet Point shared recent experiences for this article. They requested anonymity to discuss the hospital because they said they feared retaliation by HCA. All 4 doctors said the quality of care at the facility has declined significantly since 2021, when HCA cut staff and began hiring contract workers. They said that the number of so-called sentinel events, which is a patient safety incident that results in death, permanent or severe temporary harm, have risen. In January 2022, there were 18 near misses among patients about to undergo surgery, said Dr. George Giannakopoulos. I don't know how to say it, you guys. Giannakopoulos, 65, a neurosurgeon and the hospital's chief of staff at the time. One such near miss occurred, he said, when the wrong side of a patient was prepped for surgery, anesthetizing a left hip that should have been the right. So a near miss is when they almost make a mistake. So they prepped a patient for surgery on the left side for the left hip, but the surgery was supposed to take place on the right hip. So isn't that crazy? You go in for surgery on one thing and you come out with something else done. Even as Bayonet Point celebrates the opening of a new $85 million tower with 102 additional beds, recent photos of the existing facility provided by doctors show ceiling leaks in a recovery room, oxygen equipment held together with tape, bloody and backed up sinks, wires dangling from a hole in the wall, and cockroaches in the operating room. Regina Temple is Chief Executive Officer of Bayonet Point. She declined an interview request by NBC News to discuss the doctor's allegations. The hospital's spokeswoman provided a statement that did not answer many of the questions posed by NBC News, including those about allegations of rising sentinel events at the hospital, the 18 near misses or in the OR in a month, the decaying infrastructure or pests. Wow. So they had 18 near misses in the operating room in 1 month. In 1 month, you guys, they almost performed surgery and other things on 18 patients. The wrong surgery or the wrong side or the wrong medication, something, a near miss. In her statement, the spokeswoman said, "As a learning hospital, we are continually looking for ways to improve patient safety and quality of care. We apply those learnings, including reports by both federal and state regulators, to ensure best practices for quality care are in place. HCA Florida Bayonet Point Hospital is appropriately staffed to ensure the safe care of our patients. We rely on feedback from our physicians, and when issues are validated, we take necessary action." So it goes on and on about so many complaints and concerns, you guys. This place should be shut down. It really should, and that is my opinion. Would you take your loved one to a hospital if the doctors were saying the sinks are stopped up and they have blood in them? Bloody, stopped up sinks, cockroaches, and other disgusting things, leaks from the walls, leaks from the roof, holes in the walls, I wouldn't bring my dog to that hospital. And being someone, those of you who have been following and subscribed to me, I thank you, by the way, again and again and again. You know my health struggles. Um, I got sick when I was a little girl, and so I've had my entire life in and out of hospitals, surgery after surgery after surgery, procedure after procedure. And I've come across some horrors, right? Like there was a doctor who actually screamed, yelled, cursed in my face because I decided I did not want him to perform surgery on me. And he did it anyway. Um, I woke up on the operating table. Um, I suffered after surgery because there was a doctor who performed surgery, just on me. I found out it was other patients also, and was only giving us NSAIDs, which is like ibuprofen, which did not control our pain. Um, many things happened. I mean, I could write a book, but I've never been in a hospital where I saw cockroaches, um, holes in the walls. This is disgusting. Why is this place still open? And people, if you are anywhere near this Florida hospital, get your folks out of there. Don't go there. Don't have surgery there. Even the doctors, they are the ones who brought this to the public. It is a dangerous place, in my opinion. It is a damn death trap, in my opinion. Disgusting. What are your opinions? Let me know some of the stories of mishaps that you've had while in the hospital, having surgery, for any reason. Look, when you're sick, or when you have a loved one who is sick, when you need surgery or your loved one needs surgery, you want to make sure they have the best care. In my opinion, this hospital is not anywhere even a damn animal should be. So do not go to that hospital if you're in the area. And make sure that whatever hospital you go to anywhere, that they have a good reputation. Be comfortable. Make sure that place is clean. Too much goes on behind those closed doors, you guys. Protect yourselves. Take it from me. I mean, I feel like I'm a pro at this. It's been more than 40 years that I've been in and out of the hospital. So it is your body and your choice. If you say, don't do surgery on me, I want to go someplace else. If you see something that's not right, that is your choice. You may be saving your own life. Anyway, if you're in the Florida area where this hospital is, do not go there. All right, you guys, let's talk about this in the comments.